Terry Allen, Board of Health Director of Epidemiology, Surveillance and Informatics, Jana Rush, and Board of Health Director of Prevention and Wellness, Ramona Brazil. We will begin today by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Biedisch.
Thank you very much. Hello, everybody. I'd like to thank Terry Allen for being with me here again this week. I don't really know how he does it. He and his team, just when it looked like this pandemic was slowing down, we've seen this fast increase with COVID, and the Delta variant specifically is exploding. Our Board of Health is continuing to help residents stay safe and healthy. I thank Terry and his team for their continued work. When I spoke at our last briefing 2 weeks ago, I told you that our positive COVID cases in Cuyahoga County were around 60 cases per 100,000. This means that we're experiencing what's categorized as substantial spread by the CDC. And now our numbers have gone up even more. We're now seeing 105 positive cases per 100,000. This is a 75% increase. This increase has a clear correlation with our rate of vaccination. Ohio's in the bottom half of state vaccination rates, sitting at number 28 out of all the states. Terry and I have said it before, but I'll say it again. We need to get more people vaccinated. The vaccines are working, and they're the only way to finally put a stop to this pandemic. I'm tired of mask wearing and worrying, aren't you? I strongly oppose Ohio House Bill 248, which, if passed, would take away local authority to make public health decisions concerning vaccination requirements, and it would eliminate a county's ability to act locally and in the best way for its residents. Not to mention that it would have a negative impact on businesses, because it would take away the business's control over its operations. We're seeing some businesses starting to put on vaccination requirements, and this law would stop businesses cold. That's why the Ohio Chamber of Commerce, in opposing this bill, said businesses don't need to be micromanaged by the government telling them how to best run their business. All the decisions we have made have been done working closely with the experts at the County Board of Health. We need local health experts to have some autonomy to make decisions that can protect the health and safety of our residents. It's been difficult getting those still unvaccinated to get their shot, and bills like these don't help. We've not yet adopted a vaccine mandate, though we're thinking about it. But we're trying incentives right now. Ohio's Medicaid program is offering Medicaid recipients $100 in exchange for getting the vaccine. Medicaid is trying to get 900,000 additional Ohioans vaccinated between now and September 15th. Just in Cuyahoga County alone, over 425,000 county residents are enrolled in Medicaid. There are 32 pop-up and standing vaccination sites in our area, in neighborhoods like South Collinwood, Broadway, Glenville, Huff, and Detroit Shoreway, and also in many suburban communities. Many of these sites are providing this Medicaid incentive. The best way to find a Medicaid-eligible location is by visiting covidvaxonthespot.com. Again, that's covidvaxonthespot.com. Or you can call the number on the back of your Medicaid healthcare member ID card. Also, lots of folks visit our county buildings, and we want people to feel safe when they come in. So beginning Monday, August 23rd, we will be providing all county employees with 4 vaccination locations at our buildings to get their shots during the workday. Metro Health will be administering these vaccines. Thank you to Akron Boutros for being a partner in this effort. And I'm asking County Council to provide a $100 incentive to our employees who get vaccinated. Before I turn it over to the Board of Health, there's one more thing I'd like to remind you. The county received $240 million from the federal government under the American Rescue Plan Act, or ARPA. We want your input, your ideas on how to best put this money back into our community and our residents. So we opened a spot on our county website for you to make your suggestions, cuyahogacounty.us/COVID funding. And you've been using it. We've already received nearly 400 submissions from the community, and I'll tell you, I've read every single one. If you haven't submitted your idea, we want you to be an active part of this process. We can use these funds to support public health responses, negative economic impacts, or even create a transformative initiative that could have benefits to the county long after the pandemic is through. You can still submit your ideas on our county website by visiting cuyahogacounty.us/COVID funding. I look forward to reading all your ideas. And with that, I'll turn it over to Terry Allen.
Thank you, Executive Budish, as always, for your support of the Board of Health and for all of our staff, and also for discussing the use of incentives to encourage vaccinations. We know that incentives work. Increasing our community vaccination rate is the most effective way to blunt a major surge in cases this fall that would also result in increased hospitalizations and deaths from COVID-19. I also joined county executive, hospitals, chambers of commerce, and local health departments across the state in opposing House Bill 248. This bill, if enacted, would prevent schools from requiring any vaccinations for students, including measles, polio, tetanus, whooping cough, and chickenpox, just to name a few. This decision would put all children at risk in school, increase the spread of these well-controlled infectious diseases, stifle the educational trajectory of kids, and start new chains of disease transmission, a preventable disease transmission in the community. It would also prevent, as Armin mentioned, any business that chooses to require vaccinations for employees from securing their ability to make sure their employees are safe and protecting their workforce. And it would also wall off their ability to compete consequently economically. So we oppose House Bill 248. And if enacted, it really would negate the advancements of science and take public health back many decades into the past. Changing gears, I want to provide an overview on the current situation in Cuyahoga County, and you'll hear more today on data trends from Director Rush in a bit. Currently, about 56% of all Cuyahoga County residents have started vaccination, and about 52%, that's just over half of us, have completed vaccination. So we still have a ways to go. CDC indicate that 82% of those over age 65 in the county have been fully vaccinated. It's a small increase from last week, and it's good news that we're moving in that positive direction with our most at-risk community members. This is important as this age group is most at risk, of course, for hospitalizations and fatalities. 63% of those over age 18 have also been fully vaccinated. We know that those under age 12 are currently not eligible, and so that's an at-risk population that we're particularly concerned about. We continue to offer vaccination opportunities for vulnerable populations to protect as many people as possible. And as Executive Budish noted, there are over 30 locations on any given week where people can get vaccinations in the community, not including many pharmacies throughout the county that are available and many hospital systems. It includes a continued outreach in terms of reaching out to folks to try and increase vaccination, particularly in our communities of color, as about 35% of African Americans and about 46% of the Hispanic Latinx population have started vaccination. We need to continue our efforts to assure there's fair access to this life-saving vaccine. We also continue our collaboration with local foundation community, other government agencies, nonprofits, community health centers, hospitals, and grassroots agencies to spread the word on the many locations where people can receive the vaccine. Over the last several weeks, the number of COVID-19 cases reported to our office and to health departments across Ohio have continued to rise. As Executive Budish noted, our cases continue to rise from CDC's data. He noted that we are at 105 cases per 100,000 population. The most recent data that we checked prior to coming in, we are now already at 111 cases per 100,000 and rising. As of yesterday, 86 of 88 counties in Ohio are now in high transmission, up from substantial transmission, which was where we were in Cuyahoga County last time we talked with you. A very concerning development that transpired in just a few weeks, this big change. So if we go back to when we began talking with you several weeks back, we were seeing cases in the teens here in Cuyahoga County. We are now up and increasing quite rapidly, and you'll hear more about that in a bit. This, of course, demonstrates just how infectious the Delta variant is. It's been widely reported that the highly transmissible Delta variant, which accounts for the vast majority, if not all of the circulating virus in the community, has been surging and is now the dominant strain in Ohio and the nation. We've learned that Delta is more than twice as contagious as previous strains of the virus. And also, we know that 100 times more virus is shed when people cough or exhibit other symptoms when infected with Delta. Consequently, we anticipate that the number of cases will continue to rise even higher into the fall. And even more concerning, we also anticipate increases in hospitalizations and fatalities to follow. This variant spreads very easily and quickly and presents an increased risk to everyone, especially those who remain unvaccinated. Now, more than ever, it's critically important that anyone who is eligible to receive the COVID vaccine do so. Vaccination is by far the leading public health prevention strategy that can slow and ultimately end the current pandemic. Vaccines are safe, vaccines are effective, and vaccines provide protection against variants circulating locally, statewide, and nationwide. If you've been waiting, as we mentioned time and time again, now is the time to get vaccinated. Vaccines are readily available through many providers through the county or by going to gettheshot.coronavirus.ohio.gov or just by calling 211. In a new development, CDC now recommends that people whose immune systems are compromised moderately to severely should receive an additional dose of mRNA vaccine, COVID-19 vaccine after the initial 2 doses. So this would be currently for Moderna and Pfizer vaccines. There has been any release of information on the Johnson & Johnson vaccine at this time. Our co-director of Prevention and Wellness, Ramona Brazil, will talk more about this new recommendation in a bit. On the testing front, we remind everyone to get tested if you're experiencing COVID-19 symptoms, and we're seeing increase in testing volume in the community with the emergence of the Delta variant. Everyone with a known contact to someone with confirmed COVID-19 disease should get tested 3 to 5 days following exposure. It's important to isolate if you've tested positive for COVID-19 and in the prior 10 days are experiencing COVID-19 symptoms, and also quarantine if you've been exposed. As reported at our last briefing, new research indicates that vaccinated individuals can transmit COVID-19 to others if they become infected. Consequently, the board stated its support for the CDC recommendation on the use of masks for everyone indoors, whether you're vaccinated or not, in areas of substantial and high transmission. And so we're currently at high transmission and climbing. As stated previously, we're now seeing trends going in the wrong direction. Vaccinated people who contract COVID-19 can unknowingly expose their kids or other vulnerable family and friends, like the elderly or those that are immune compromised, and certainly nobody wants that. Since children under 12 are currently not eligible for vaccination, the concern is that Delta strain will present an increased risk for exposure to them and those around them, and they might in turn expose others if they become infected. We know businesses are also in the community, the big box stores, many are following CDC's masking policy to protect their workers and recommend that the patrons do the same. We also are glad that the county buildings and many other government buildings are following suit. And most recently, the Cuyahoga County Public Library is now requiring masks at all of their branches to protect their patrons and workers as well, and we appreciate their leadership. Masking together with vaccination are necessary to slow the spread to prevent surges of new infections that could increase COVID-related illness, hospitalizations, and death, and also stress our healthcare system. This is why the hospital systems all support the recommendations for indoor masking and have maintained these requirements throughout the pandemic. Bearing in mind the guidance from CDC, we've also recommended that teachers, staff, students, and visitors at schools wear masks when indoors in school settings, regardless of their vaccination status. I know the governor reiterated the need for masking in schools as well very recently. It's a best practice that continued to reduce the potential for COVID-19 transmission and other respiratory infections. And we know that the majority of kids in school, the majority are currently not eligible for vaccination, and we need to think about that risk and what that poses, not only to folks working and being educated in the school system, but to the greater community. We also know CDC recommends that we maintain the 3 feet distance between students in the school environment. So we want to layer prevention strategies in school as much as possible to provide the safest environment that we can, including mask wearing, grouping students into smaller learning pods, hand washing and sanitizing, cough and sneeze etiquette, improved building ventilation, symptom testing, and also having people stay home when they're ill. Together, the vaccine and the mask form an insurance policy against the virus. The vaccine can protect almost 99% of people who've been vaccinated from the severe effects of the virus, and masks prevent you from unknowingly exposing someone if you are vaccinated. Without these two tested prevention strategies, the cost could be high to you and those you care about who you may unknowingly expose to the virus. Those who are vaccinated are at much lower risk for symptomatic or severe infection. And we know that unvaccinated individuals account for an overwhelming percentage of all hospitalizations and nearly all the deaths from COVID. This fall, we should say the fall is coming. Flu season is coming, and other respiratory viruses will also be circulating in the community, along with the Delta variant. We have learned a lot over the last 18 months. We know what works. Get vaccinated and mask up. It's our only way out of this. And I thank you for your time and attention, and I'll turn things over to Director Brazil.
As their turn comes.
About the vaccine campaign, as a lot of information is starting to be released about additional doses as well as booster doses. And we know that that type of information is concerning for a lot of folks as well as confusing. So we wanted to provide as much information about what we know right now. We are still learning as new information is being released about the booster doses. So overall, COVID-19 is doing what viruses do. You know, they mutate in order to continue spreading and to adapt themselves to evade our body's defense mechanisms. It is very clear at this point that COVID has a lot of staying power and a lot of fight. And we have to layer, as Terry mentioned, our defenses against it to ward it off. We are still encouraging, even with this news, that we're looking at additional doses or booster doses. It's still really important for people who have not started their vaccination series to get vaccinated. In many ways, I think of COVID as a tornado. It may come down your street. It may not touch your house. Your house may be fully intact, and the house next door might be devastated. And you really don't know if you're going to be the house standing or the house that's wiped out. We've seen it too many times, and there's too many sad stories to share to try and continue to convince people to get vaccinated. We definitely understand the fear of vaccination for groups of people, but every day we see how these cases are surging, and we're seeing our hospitals again starting to be full again and kids getting sick. And so understanding that now is the time to move forward with vaccination if you've kind of been sitting back and trying to understand what will be the impact of COVID or the impact of vaccination itself. We continue to focus our efforts on areas that have lower vaccination rates and where there may be issues with access, and there's these disparities in health outcomes, in hospitalizations and death rates. So one of the things that, we're hearing a lot more about are breakthrough cases. And breakthrough cases are those that occur after a person is fully vaccinated and they acquire the infection. And those can occur with a lot of different vaccines. But it's not a reason not to get vaccinated. So I've kind of, heard a little bit on social media of people saying, well, you're going to get it anyway. The likelihood that you will have severe illness and hospitalization and death is still significantly lower if you're vaccinated than if you're unvaccinated. So it's still really important not to just think, oh, well, it's the same. It's still not the same. Your risk is much lower if you get vaccinated. So we still want people to continue to move forward with that. Now, the additional dose and booster doses, they're not exactly the same. So right now, the authorization that we have under the FDA, the CDC, and now the Ohio Department of Health and Guidance is to provide an additional dose for those who've received Moderna or Pfizer who are immunocompromised. And so immunocompromised would include people who have had organ transplants, who may be going under an active cancer treatment. You've had a stem cell transplant in the last couple of years. You have a moderate or severe primary immunodeficiency type of syndrome. You have advanced or untreated HIV infection, and the conditions that where you may be taking medications that are going to suppress your immune response. So essentially, this additional dose is for people who may not have had a great response to those initial 2 doses. And the booster dose is going to help those who had maybe a good response, but their immunity protection is starting to go down, to boost it up. And we're seeing that, with the Delta variant, that probably is necessary for our general public to help continue to fight against COVID. So we really advise, if you think you fall under one of those parameters, that you do talk to your healthcare provider. It's very important because, especially if you have those types of conditions, your healthcare provider knows you better than anyone else. They know your health status, they know what medications you're taking, what your treatments may be or may be coming up, and that may affect the timing in which you would receive that additional dose. So we definitely want people to stop and make sure you do a check-in on that. You can, we're in a better space than we were earlier in the spring, where vaccine supply is much higher and also available in a lot of different spaces. So you can still choose to go and get that vaccine where you want to go, but do that check-in with your healthcare provider before you do that to make sure that it's advisable. It's only expected that a small amount of our population kind of falls into that right now, only about 3%. So most of us are going to fall into the booster doses, which may come a little later. So the last thing is, if you receive Johnson & Johnson, there's still research going on to understand if an additional dose at this time is recommended. So for folks who receive Johnson & Johnson, the advice is that you wait. We do not recommend that you switch between vaccines. So if you receive Moderna, you should receive Moderna. If you receive Pfizer, you should receive Pfizer for that 3rd dose. And that 3rd dose for both, whether it's Moderna or Pfizer, needs to be at least 28 days from the 2nd dose that you received. And that's a little different than those initial 2 doses for Pfizer. So, seek out that healthcare provider. See if that is advised for you, if you fall into those categories. If you're not vaccinated, as Terry mentioned, now is the time. And then for those who are waiting on the booster doses, just continue to follow the guidance. Don't panic. Clearly, we have a lot of vaccine and we have a lot of capacity in our community to be able to deliver that vaccine. So, with everything, vaccine is still our best defense against COVID. And so I just want to encourage folks to continue to seek that out and to follow other preventative measures to keep you and your family safe. And with that, I'm going to turn it over to Jana Rush.
Okay. Good afternoon, everyone. So we are going to cover our pandemic situation and provide an update on some of the current trends and the data that we're seeing over the past couple of weeks. So something new that we recently launched at the beginning of August was our COVID-19 dashboard, which is located on our website. So this replaces the information that we were providing previously through our data briefs. And so all of the information that's contained on the dashboard is updated daily, most of these indicators. There are some that are updated on a weekly basis, but we have a description at the bottom to give information on those that are updated. So first, I'm just going to cover overall trends that we're seeing in relation to our case data. And then I'll go through the dashboard in specific just to cover some of the information that's contained within the tabs. So first, overall, COVID-19 cases, hospitalizations, and deaths continue to increase. We're especially seeing those in the areas that have a higher level of community transmission, as well as lower vaccination coverage. And as Commissioner Allen has stated before, we're currently in the high level of transmission for COVID-19 activity in Cuyahoga County. And so our 7-day average for our cases, we're currently seeing at 140 cases per day being reported. And so that's a 35% increase compared to what we were seeing as an average over the previous 7 days. And so in comparison to where we were just in July of 2020, we are already exceeding where we were. We were at about 100 cases per day back in July of 2020. So we've exceeded that rate. And so we've also been watching closely some of our modeling data. And so with that data, we are on track to exceed more than 250 cases per day by late August. So that's about a 25% probability that we're going to move in that direction by that time frame. And so we're going to continue to watch that data closely as we see more and more cases being diagnosed. For hospital admissions, our 7-day average, we're seeing about 150 patients that are hospitalized due to COVID-19 over the past 7 days. And that's been an increase of 26% over the previous 7-day period. So again, we're going in a direction where things are beginning to increase pretty rapidly. And we're also seeing a slight increase in our deaths. We had about 5 deaths reported this past week, and the prior week, 3 deaths. So we haven't seen a huge shift or change as far as the average number of deaths we're seeing. Is still less than 1 per day right now, but we know that lags cases as well as hospitalizations. So we will likely see those continue to increase over time as well. So in relation to testing, our positivity rate has also started to increase. There is some lag time with that data, but currently we are seeing almost 4% or 3.5%, I should say, positivity rate compared to 2%. And so our total number of tests, though, that are being conducted is also increasing. So a 13% increase in the number of tests that are being ran for COVID-19 over the past week. So variants. So we're seeing all the variants currently circulate throughout Cuyahoga County as we're seeing nationally. Right now, the Delta variant is the most dominant strand that is circulating for COVID-19 across the nation. Is currently second for us, and that's likely to catch up over the next couple of weeks to be the dominant strand that's also circulating in Cuyahoga County. And as was stated previously, this strand of the virus is much more transmissible than other strands of the virus that are currently circulating. Something else that we're paying close attention to as well is our pediatric cases. So those cases and hospitalizations are also starting to increase. We know that cases among children, there's a much smaller proportion of cases that are associated with those that are less than 18. So about 13% of our cases are represented by children, and that's in comparison to about 10% around the state. And so the average number of cases that are having severe outcomes nationally, we're seeing about 5 per week is the average. So we know that children also can suffer from severe outcomes in relation to COVID-19, although on a much smaller scale. Is something that we're still paying really close attention to. In particular, those children that may suffer from complications after COVID-19 diagnosis with a multi-system inflammatory syndrome. And so that's another diagnosis that we're watching closely and paying close attention to as we move into the fall and as children return back to school, knowing that they're more vulnerable due to the fact that they are not eligible for, if you're less than 12 years of age, you're not eligible to receive the vaccine. And so that's something that we want to be mindful of. And so as you can see on the screen, this is the overall demographics kind of that I covered in relation to case information that's updated daily. If you click on the demographics tab, which is the first tab there at the top, okay, it looks like it may be taking a second to click on. And so this is the demographic breakdown of our cases. This information, again, is also updated daily. If you toggle and click on any of the tabs there, so for instance, if you want to click on that age group and you click on the 1 to 19 tab there. So when you click on that, what will happen to the screen is you'll be able to see the demographic breakdown specifically for that particular age group. And you can do that for any demographic on the page, which I think is very helpful for people to be able to see that information in real time. And you're able to make comparisons across different types of demographics. And so you could do the same thing for race, whether it's, and also for sex, and whether someone's a healthcare worker or has a pre-existing condition. So you can see those breakdowns across all of our cases cumulatively. And the way to toggle back and forth between the main page and one of the breakout pages is that you just click the button again, the arrow at the top right-hand side of the screen, and then you're able to toggle into any of those other areas. And so if we click on the testing tab, which is the last tab at the bottom, so I kind of talked about this information in relation to our case positivity rate beginning to increase. So as you can see at the beginning, even going into last year, you can see a much larger proportion of tests were being ran. And you can see that the positivity rate, which is the blue trend line, that is the level of positivity that we're seeing in the community in relation to the orange bars that are showing the number of tests that are currently being ran for that particular week. So as you can see, that blue trend line is going back up pretty sharply, as now we really went to a lull in the positivity rate in Cuyahoga County. And so now that's beginning to go back up on an upward trend. And so as you can see, we're on trajectory to surpass or at least meet where we were previously back in April. So if you want to toggle back to the main page. And so the other thing that I wanted to show that's different is our map. So if you go to the view map tab there in the center, so this information that's different that we didn't have in our brief that we have now is this actually shows you the cumulative counts. So the top graph shows the circles. So the larger and the darker the circle, the higher number of cases that are associated with that particular zip code. And if you hover over it, it gives you the zip code as well as the case count. And then on the right-hand side of the graph, the blue bars. So in descending order, you're able to see the number of cases by frequency based on those with the largest frequency to the lowest level of frequency by zip code. And so the same thing happens at the bottom of that graph for the number of rates of cases. So you're able to see rates by zip code as well. And that same thing is in the histogram with the blue bars on the side. So you're able to see in descending order the rate of cases for a particular zip code. So we can go back to the main page. And so if you scroll down on the page, we have a second dashboard that's here, which is our vaccination dashboard. So this information you'll see, it pretty much mirrors on the main page what you will see on the ODH COVID-19 dashboard. And so that information pretty much is the same, but you're able to go here and see specifically for Cuyahoga County. The state, of course, shows all counties throughout Ohio. So you're able to see that information as a snapshot here on our page. Again, this information is also updated daily in relation to that. And as we stated, 50% of our population is currently vaccinated. And so you're able to see that by person. We're able to look at week by those that started vaccination. So you're able to see the chart at the bottom that has the orange and blue lines. The blue line is those that have started vaccination, the proportion, and the orange line are those that have completed vaccination. So for each week, you're able to see what proportion of people have started vaccination versus those that have completed. And so as you can see, when you look further back into like May, March and April, you're able to see a higher proportion of people were really completing vaccination. And as we moved here into the fall, there's a much smaller proportion that is completing vaccination. So hopefully as more people get started with vaccination, we'll see that orange bar rise more as more people completed from the first vaccination. And so if you click on the gray tab, there where you say CCBH vaccine administration. And so it may be taking a second to load up the page. Okay, so here, this data is specific to Cuyahoga County. So in contrast to the data that you saw on the main page, which was for vaccinations overall for Cuyahoga County, these are vaccine administrations specifically for the Board of Health. So these are vaccinations that have been administered by our health department. And so it gives you a breakdown looking at demographics as well in relation to that. And so again, this is in relation to people starting vaccines, not the actual number of vaccine administrations, because we know that each person, depending on the dosage that you receive, receives 2 doses. So doses is different from actual patients or people who are receiving the vaccination. And so those are the numbers that you see here on this dashboard. And you're able to see that breakdown by age group. As you can see, it's pretty even, but of course, a higher number of those 50 and 60 and older population have a higher vaccination rate, which is also in alignment with what we're seeing statewide as well. And so if you click back to the main page, you click the gray button at the top there at the bottom. And so that takes you back to the main page to see overall. So we're happy to be able to share this information with the community. We know that it is a useful resource and tool for people to use because you're able to see this information now more in real time. And we'll continue to add and build upon the information that we have here as we obtain more data into the dashboard. So I think that's all that I have. Thank you. And I'm sorry, I will turn it back over to Commissioner Allen for questions.
All right. Thank you all very much for your remarks and helpful information. We now have a few minutes for some questions. So please state your name and media organization when asking a question, and remember to stay muted when not speaking. So with that, we will take a question, please. Any questions?
Hey, Terry. Scott Knoll from News 5. How are you?
Great.
Good.
You can go ahead, Scott.
Can you guys hear me okay?
Yes, thank you.
Can you talk a little bit about the contact tracing that's going to be done in schools once classes begin, assuming there is a positive case in a classroom?
Sure. Thanks for your question, Scott. So it will really be no different than it's been throughout the pandemic response. The schools, and I want to reinforce this, have been tremendous partners. For the majority of this response, we've been meeting weekly. The Educational Services Center, a great partner, has been coordinating calls with all 33 superintendents, and we've been giving them guidance around health and safety, ventilation, around a range of employee health and safety issues within the school environment. They've been helping us, of course, because who knows better than the schools on what sort of exposures may take place in the school environment. They have a range and have made decisions at the school board level on masking policies. Some have universal masking requirements. Some have masking specifically required for those under age 12. And there's a range of options there based on what's been the choices that have been made at the district level. We certainly encourage everyone to really consider and recommend that everybody mask universally in schools. And so what we will do is work with the schools as we have to help identify those that were exposed and those that are positive. Those communications have been ongoing, and that will be essentially identical to how the process was carried out throughout the pandemic. So there should be no change in reference to how this rolls out. There are some specific guidance that have been put out by the state health department, which has been published, that relate back to whether people are masked or not. That is, whether the person exposed or the person that may be positive is masked. And so there may be some nuances there that we will work through with the schools relative to how masking is being done in the school and how it may relate to an exposure. But the schools are aware of that. They're also fully aware of the requirements to report on a regular basis. All that data, as you know, Scott, rolls up to the state website so we can track exposures in the school environment, also in the long-term care environment.
Thank
And
you.
is the contact tracing something that will be done by CCBH, or is it something that will be done by an agency or an organization that you guys then contract with?
So there's sort of a tiered level of questions there. So in the school environment, the schools can help us identify those that might have been exposed, and that's going to be identical. So what we do on our contract tracing work is and also on our case investigation work, is we've been using a range of capacities. We have our staff that are helping out with case investigation. We have some contractors that have been helping out with case investigation as well, and as well as some contractors that are helping out with the following up on those who were exposed for quarantine. So we have a range of capacities. We had to build it out because this has been, as you know, Scott, this has been a long haul. And so we've had to diversify our capacities. We've gotten some support from the state health department on those funds, of course, from the county executive and county council, which we appreciate, to carry out that work as well. So we've got to diversify and then ramp up based on our needs and based on the number of cases that we're seeing and the trajectory that we're following. So it's really a combination of all those resources.
And did you guys use the contractors last school year as well?
I think we began using them. I'm trying to think of when we began using the contractors. I think we began using them last fall. In fact, there have been a number of contractors that were made available to us statewide through the state health department through a central contract. And also we've had some nurses that have been made available in a similar vein. We also have local resources for contractors that have helped us scale up. And we found them to be very useful in their ability to expand their hours and their available times, weekends, evenings, based on our surge that may be occurring. And so we think it's been a good model for us to diversify our capacity, because we of course have had times when we want to make sure that staff get a breather and they can take a break. Many staff also are already back working in their normal programs. So we've got to be able to move between the two and continue to serve the community and the needs of the pandemic, and also the range of other public health services, essential public health services that the community expects of us.
Any idea how much you guys have spent on contracted contact tracing?
That's a good question. I don't have that at the top of my top of my head here for you, Scott, but we can certainly respond back and to you and provide you that number on contracted services since the beginning. We'll be happy to provide that.
All right. Thank you for your questions, Scott. Appreciate that. Anyone else? Okay. Well, with that, thank you all for your questions. That concludes this week's briefing. Thank you for joining us, and we will see you in a few weeks. Have a great day. Bye-bye.